They say that abs are made in the kitchen, but as a plastic surgeon, we know they're made in the operating room. I'm Dr. Jonathan Kaplan, board-certified plastic surgeon. The internet is losing their mind over Drake's alleged ab implants. Here's what I think he actually had done and how much it cost. When you take a closer look at this photo, it looks like Drake has actually had ab etching done, or abdominal etching. That is part of a liposuction procedure. And typically in liposuction, you don't want to get too close to the skin because it can cause contour deformities. But with ab etching, that's exactly what you're trying to do. You're getting really close under the skin to define those edges of the six-pack muscles. So you're going along the linea alba in the middle, the linea similumeraris along the edges of the outside of the six-pack muscles. And by making those deformations of getting really, really close to the skin or removing more fat in those areas, along with ultrasonic liposuction techniques, you can actually get more definition and show a greater outline of the six-pack muscles. So if this is really what Drake did, remember, this is real surgery. The operation itself can take a couple hours, but the really more difficult part is the post-operative care. You're having to wear a garment, you're wearing a foam board along those lines to keep those depressions in place so that they don't fill with fluid under the skin, because if you get fluid under the skin, a seroma, then you have to drain that with a needle. So there's really a very specific post-operative care routine. Depending on the quality of the surgeon and how much experience they have, really great ab etching, probably what Drake got, can definitely cost tens of thousands of dollars. Now, as a plastic surgeon, I'll tell you, men getting plastic surgery is a much more common thing than you realize. This particular procedure is very popular for actors and entertainers, but also just the regular guy on the street that's trying to look a little better, have a little more definition, and that even though they have a great healthy dieting routine, they still can't get that definition they've always wanted, that they see in the movies, they see in the magazines or online, and this is a way for them to get that extra 5% to really differentiate themselves from everybody else in the gym. You may know somebody who's had ab etching and you've never realized it because they never took their shirt off in front of you. So in summary, he didn't have implants, he had ab etching. But one thing that Drake is doing that a lot of surgeons love when their patients do it is they get in the best shape possible. He really works out. He's doing a lot of crunches. He's making his six-pack already look good. So that makes the job of the surgeon easier to really provide that definition. The same reason I like when patients get on their GLP-1s beforehand. It helps them lose weight. So whatever mommy makeover or body contouring procedure they're getting, their results look that much better. They're going to be much more proud to put their photos on Instagram, their before and after photos, because they look so much better with doing the work ahead of time between working out, losing weight, whether it's GLP-1s or diet and exercise. Either way, the patient doing their part makes the surgeon's job that much easier. Thanks for watching, and don't forget to subscribe for more celebrity surgery content. And of course, if you have any questions, ask away in the comments.